Okay, we're recording. Okay, let's go ahead and get started. Today we're going to talk about, we're going to drill down to the next level. So you guys were on a couple weeks ago on the overview, the drink from a fire hose. Today we're going to dig down into the core of the system, which is operational planning. So we're going to walk through is all the different levels of the pyramid we talked about, get some real life public health examples of the different levels here. We're actually at the end going to go in and put in an operational plan so you can see all the steps to enter a plan in the system. And then this is the only module that there's homework. The homework is that I'm going to ask you to go away and in the system, in the training group, create a little simple operational plan. I like for people to have fun with it. So things like planning my kid's birthday party or planning my trip to Vegas or whatever it happens to be, just something really simple, typically about 6 planning elements, one service or initiative, one goal, one objective. And if you can figure out how to use the different types of activities, maybe 3 activities in there. And then our next session, we're actually going to go through and review those plans just to make sure that you've got all the different levels kind of in a correct format here. So let's go ahead and get moving here. Our workhorse development here. Okay, so let's kind of review the pyramid model here. The organization is just your health department. Typically, when you go to that tab, you're only going to see one entry in there, and that's your health department. Underneath that are your groups. Groups is primarily the structure of the health department, so the hierarchical structure of who reports to who, not who, but which divisions and offices and programs reports to each other. And then these plans that you see up here in the bubbles, the Fab 6-pack of plans, are typically independent groups. So let's go look at your group screen here. So this is the Essex group screen. The top level is the department, and that's typically always the number one group. Now, the levels you see over here are hierarchy. So 2s always report to 1. You guys don't have any 3s in here. If there's 3s, they report to 2s, 4s report to 3s, etc. And you can go 10 levels deep, which nobody's ever gotten to. So you see that, for instance, the strategic plan is a level 2 group reporting to the department. And if I get down here farther, you'll have like health education is a level 2 group. And you see down here, the parent group is a department. So this is how things are structured. Down here at the bottom, we have these training groups. And we have the Tobacco 2023 and Tobacco 2024 groups under training. Today, we're going to work in the Tobacco 2024 group here. So that's your group screen. Again, divisions, offices, programs, and primary plans. Fab's 6-pack of plans are typically independent groups. Each group then has its own set of services or initiatives. Sometimes plans start at the group level. So for instance, the ones we talked about, the strategic plan is a group within itself. Some plans, like the ones that you guys will be creating, are typically going to start at the service or initiative level. Services are ongoing things, like WIC is a service. Initiatives are future projects that we're trying to accomplish here. So we're going to use, again, probably the example of tobacco cessation as our initiative, something we're trying to accomplish in the future. Each service or initiative then has a set of high-level goals. And again, we're going to get into great detail on all these in a minute here. Each high-level goal has a set of SMART objectives. Each SMART objective has a set of activities or action steps here. Now, what you see here in the nomenclature, organization, group, service initiatives, goals, objectives, and activities, is probably the most common nomenclature for operational plans, but it's not cast in concrete. Nobody says you have to use this. So we see all kinds of different variations of this. And, sometimes I blame the consultants. They come in there and say, oh, this is my own version of an operational plan, and they change the names around. So what I'm going to do is kind of walk through some of those different models that we've seen, just so you have an idea of if I see this, it could be a group instead of, whatever they're calling it in there. So let's look at some of those examples. So here's one. Strategic priorities and what we call services or initiatives. Goals. What we call goals, strategies for objectives. I'm just, for some reason, I don't care for that one. It kind of rubs me wrong. Strategies are how we're getting someplace. Typically, the strategies would be more like the activities to get to an objective. So I think if we flipped objectives and strategies around, it's a pretty good model here. Strategic priorities is the most common terminology for the top level of your strategic plan. Strategic areas is a pretty good definition of what a service or initiative is. And then goals, outcome objective. I like that term. Because the objectives are what outcome are we trying to achieve here. And then the strategies are the activities that we're going to do to get to the objectives. Here's another example: priorities, goals, objectives, and action steps. Action steps, I would say, is the most common term that we see for activities. It's the steps we're going to go through to get to the objective. Priority areas, goals, strategies, again, kind of in the wrong place, I think. Action steps. Priorities, goals, objectives, and strategies. That's a real good solid one. And then strategies at the top. I don't know where that comes from. Strategic objectives and objectives. Strategic objectives, by the way, is not bad. It's a higher level than an objective, so kind of fits with the goal. Then objectives and action steps. So again, the reason I show you this is at some point in time, somebody's going to come up to you and say, here's the plan I want to put in the VMSG dashboard. And it's going to have some different nomenclature in here. After today, you should be able to easily identify the different levels of the plan and put it in the system. And one thing I always offer is if somebody sends you a plan and it looks kind of crazy and you say, I'd like to have a little help in getting this thing started, send it my way. I'll be happy to get it started for you and then sit down with you and walk through the steps of getting it finished up here. So what I want to do now is go through each of the different levels of the pyramid here. So the first thing is the groups level. Well, you saw your group structure. The basic group structure is like this. The department is typically always the level 1 group at the highest level here. Underneath that, let's say we have a community health division. It's a level 2 group reporting to the department. And then maybe under community health, you would have WIC. WIC would be level 3, reporting to community health at level 2, reporting to the department at level 3. So you can see the hierarchy. Now, it's really, really simple. If let's say, for instance, WIC kind of got promoted to a department level division here, is all we have to do is change that level to 2 and then change that drop down for parent group from CHD to department, and poof, it's a level 2 group at the department level. And by the way, if you change that, it doesn't affect anything downstream. It just changes the nomenclature on the group screen here. As we mentioned, each of the primary plans is typically a level 2 group in itself reporting to the department. So your strategic plan and your CHIP are level 2 groups. Again, we're going to use the same example we used in the overview, Tobacco 2024, as our group for today, and we're going to use the one under the training group. So it's a level 2 group reporting to training in this particular case. So that's the group screen. Again, hierarchical organization of your department. The next level we're going to talk about are services initiatives. I kind of like to describe these as buckets. This is a container for the plans. So it's kind of defining what are we trying to accomplish at that highest level, and then underneath that we're going to have plans that'll get us there. So here's some, again, real life public health examples here. Healthy moms and babies, again, it's a bucket, it's a container. Readiness for emerging health threats. Effective agency processes. Access to care. Behavioral health and substance abuse. Population health. Organizational excellence. Chronic disease prevention and control. Health disparities. And then we'll use the example again of tobacco cessation today. So if you look at these, none of these are real actions or activities. It's more or less just a description of what we're trying to accomplish here. The next level down is our goals. I like to think of goals as being very high level and fairly simplistic here. Most often you'll see a goal as an action verb followed by a few words. So here's some examples. Reduce the risk of infectious disease. Promote safe and sanitary food establishments. Support communities in building resiliency. Enhance healthcare through technology. Drive health in all policy agendas. Reduce the risk of vaccine preventable diseases. Promote public health readiness and response. Promote succession planning and career growth. Integrate a data-driven best practices approach. And then again, we're going to use the example of reduce smoking in high schools. So what I like to kind of point out here is if I look at any of these goals, like reduce smoking in high schools, perfect sense, it makes perfect sense as to what we're trying to accomplish. What it doesn't tell you at this point is where we're going to start, which high schools. How much can we reduce smoking? By when are we going to accomplish this? So the goals, again, are high level and fairly simplistic. The next level down is where we start getting into the detail, and that is what we call the SMART objectives. And again, if you go out and Google SMART objectives, you're going to get 100 different definitions. Our definition is specific, measurable, attainable, relevant or realistic, kind of take your choice there, and time-based. Primarily, we like to focus on specific, measurable, and time-based. If it's not realistic or not attainable, why are you going to go after it? Why are you going to waste your time in there? So specific, measurable, and time-based. So here's some examples. By December 2024, identify 2 or more strategies to collaboratively reduce risky alcohol-related behaviors. So if I look at this, the specific part is the strategies to collaboratively reduce risky alcohol-related behaviors. Our measurement is 2 or more, and our timeline is by December 2024. So it fits the model pretty well. Look at that in each of these. By December 2024, 80% of educators and school staff have been exposed to ACE awareness education. By June of 2024, provide 6 training opportunities for first responders who work with individuals in a mental health crisis. By the end of fourth quarter, all programs will have established goals, objectives, and activities to be reported on in the VMSG dashboard. And then we're going to use the same example, reduce smoking at my alma mater, Wayne High School, by 25% by the end of the school year. So I think if you look at each of those, they pretty much fit the SMART model. I like to think of objectives as a target. What are we trying to accomplish? Now, again, when I tell you reduce smoking at Wayne High School by 25% by the end of the school year, great target, right? How are we going to get there? We don't have a clue based on this how we're going to get there. That's when we get down to the activities, or a lot of people call them action steps here. Now, you may recall that there's 3 distinct types of activities in the system. Project-based activity is by far the most common. It was the original and the only one at one point in time. And then over time, we added the different types here. But think of anything that's a project, something you're going to complete in a given period of time, like create training content and materials for students and faculty on the dangers of smoking. Sounds like a project. We're going to do some PowerPoints, maybe some videos, maybe some user guides, things along that line. Whatever we need to go out and do the training. Every activity is going to have a performance measure. Now, the project-based activity is the most simple one, and you're going to create the performance measure. So what you're saying to yourself is, how do I know when I've successfully completed the activity? So if we're creating training content, once we've created the training content, we're done with the activity. So it's pretty simple. We're going to have a date range in here. This is the initial date range when we're going to start. And over time, these dates, by the way, can move. COVID happens or whatever. You might be moving the ending date around a bit. We're going to do team assignments. So we're going to assign team members and team leads at the activity level. We're going to do partner assignments, external partners. So if you're working with somebody on the outside, you can potentially have an external partner in there. Our metric in this case is really simple, percent complete. So how far along are we in creating the training content? Now I'm going to go into a lot more detail when we actually enter this into the system here so you can see all the different variations. But for now, we'll just kind of get an idea. So our second type of activity we call a quality assurance activity. The QA activity is unique in 2 things. Number one, it's cyclical. So what we're going to do is set a frequency, and that frequency can be anywhere between weekly and every 5 years, but it's a repeating activity. So we're going to do 9 training sessions each month. So our month is our frequency. The other thing we're going to do on this particular one is we're going to set values that set the traffic lights. For the most part, the goals, the objectives, and the other activities are a manual setting for the traffic light based on your knowledge of the situation. You're going to decide where the traffic light should be. But in this case, we're going to say, okay, if we get to our 9 training sessions each month, the light will automatically turn green. And then we're going to set a red value in here that says if we only get to 6, and you pick the number, it could be anything you want. If we only get to 6 or less, the light will be red, and then we don't have to set a yellow value because it can calculate anything between 6 and 9 will be yellow in there. Instead of a beginning and ending date, we have a cycle start date and a frequency. So in this case, the frequency is monthly. So if my cycle start date is May 1, then the end of May is my cycle would be my end date. Then we're going to automatically move into June. I'll show you how that happens here. So June 1 through June 30th, and then July and so forth. So we always have a beginning and ending date. In this case, it's calculated versus defined here. We're going to have a performance measure that will be created for you, and I'll show you how that happens. Training sessions provided, measured monthly, green, yellow, and red. And then again, we're going to do the team and partner assignments. And as you can imagine, our metric is real simple. How many training sessions did we provide? So that's the QA activity. Least used because it is specific to something that's repetitive. The third type of activity is the quantitative measurement. That's real simple. We're measuring a quantity. So it's almost identical to the project-based activity with the one exception that we have a target number. So in this particular case, we're saying we're going to contact all 20 tobacco vendors within a mile of Wayne High School to ensure they're not selling to minors. So our target quantity here is 20. If you think about that, it makes it easy to calculate. So if we only did 10 of 20 contacts, obviously that's 50%. If we did 15, it's 75%. So that's kind of what you're using it for. And you can count lots and lots of different things. In public health, you're going to count vaccinations. How many vaccinations did we do, or how many medications did we distribute, or how many car seats did we distribute, that sort of thing. We're going to have a beginning and ending date, just like we did on the project-based activity. The performance measure, again, will be created for you, and we'll show you how that happens. So the performance measure is 20 tobacco vendors contacted between May 1 and June 30th. And then again, we'll do team and partner assignments. And it's pretty simple to figure out that our measurement in this case is going to be number of vendors contacted. So again, if we contact all 20, it's going to calculate to be 100% complete. So those are the three types of activities. Now, pretty much at the bottom of every one of these screens, you've seen the activities from the tobacco program. What I'm going to do now is kind of put those in order so you can see how the plan lays out. So the group was tobacco programs for 2024. Underneath that, one of the services was tobacco cessation, or in this case, we marked it as an initiative. Our first goal was reduce smoking in high schools. Underneath that, we had a SMART objective of reduce smoking at Wayne High School by 25% by the end of the school year. And then we had the activities. We're going to create training content. We're going to take that training content, go out and provide the training sessions. And in parallel with the training, we're going to contact tobacco vendors. So that's the one step of our plan. Now, plans can replicate at any level. So for instance, I have reduced smoking at high school as my goal. I might also have a goal of reduce smoking in colleges. And then underneath that, I could have a SMART objective of reduce smoking at, in this case, Wright State University, my other alma mater in lovely Dayton, Ohio, by 25% by the end of the school year. And then I'd probably have similar activities underneath that. I can replicate up at the tobacco cessation level. I can have multiple services or initiatives in my plan. So you can have this, as big as you want it to be. In some cases, something like your strategic plan, you'll have this over and over. So you'll have somewhere between 3 and 7 strategic initiatives up there. Let's say we have 4 of those. Each of those has 4 goals. Each goal has 4 objectives. I'm just making up these numbers. Each objective has 4 activities. I think if you do the math, that's like 256 activities. So you can have lots and lots of replication if you choose to. Now, we have this plan in a template, and we've attached the template to the meeting invitation. So you've got a blank copy of this template. It was actually created by one of our health departments in Wisconsin. When they first started rolling out the system, they weren't really comfortable going straight into the system and entering data yet. So they built this template. It's a Word document with a bunch of tables in it. But what it allows you to do is create an operational plan in this Word document, pass it around to your folks, on email, get everybody's input on it, and then go put it in the system. One way to do it. For today, the benefit of doing this is you don't have to sit and watch me type. So I'm going to copy and paste things out of this particular template right into the system here. So let's go back to here. So I'm down here at my Tobacco 2024 group. I'm going to go down to the services and initiatives for that particular group, and you'll see there's nothing in there. So I'm going to go over to the actual template. So this is the Word document template here. Scroll down. A couple things I like about this template. One of them is it gives you a quick little definition of each level. So up here at the very top, you see service and initiative, and it says, what bucket of work or priority does this relate to? That's my analogy of a bucket in here. What's the container for this? In this case, it's tobacco cessation. So my first goal, what is your, I don't know if I care for the term pie in the sky, but what's your high level goal? Reduce smoking in high schools. Then we get down to the SMART objectives. Specifically, what and when do you hope to accomplish? And then the objective lead is the person who's guiding us, to do that. Activities are, what are the steps you will do to accomplish the objective? Performance metrics. How will I know when you've successfully completed the activity? Activity leads are the team of people who are actually doing the activity, and then you're going to have your dates in there. So it really is kind of a nice document if you're just getting started using operational plans. So let's go ahead and enter this in the system. So what I'm going to do is I'm going to highlight tobacco cessation. You can right click and copy. I prefer using keyboard shortcuts, so I'll hit Control C, copy on the keyboard. I'm going to go back over to our plan here. Since there's nothing in here, I have to either hit the plus button to add a record or this really big plus button at the bottom that blocks you from entering anything. So I'll click on this, opens up the field. I'm going to hit Control V as in Victor to paste it in there. This little box up here determines whether it's a service or an initiative. It does some things down the line to reporting and things like that, but for the most part, the plans are identical, whether it's a service or initiative, until you get down to, like I say, reporting and the dates on activities and that sort of thing. So we're going to call it an initiative. Anytime you change anything down here, you're going to save it. So the save button is over here. Click on that, and it shows up under tobacco cessation. Now let's go grab the goals here. So our first goal is to reduce smoking in high school. So I'll grab that. Again, Control C, go back over here. I'm going to go down to my goals tab. Once I've selected tobacco cessation, and it's the only one in here for now, the goals will be specifically for tobacco cessation. If I had multiple initiatives, then I could select one and select the goals for that initiative. Again, I'm going to click down here and open it up. Control V to paste it in there. I'll go ahead and save it. So now we have our goal of reduce smoking in high schools. At this point in time, I got the traffic light. If you're entering an initiative, since it's typically a future program, you're going to be on track. You haven't had a chance to get behind schedule. So typically it's going to continue to be green. Now, at this point, you could change it to yellow if it's something slowing it down, or something bad happened, brought us to a screeching halt, it's red. Or if you've completed it, you can call it gold. So you can either do it through the drop down, or you can just cycle through with your mouse here and get to the different traffic lights. And anytime you make a change down here, you're going to go ahead and save that. So now I have our reduce smoking in high schools as my first goal. I think I have a couple other goals. So I'm going to go down here, reduce smoking in colleges. So let's grab that one. Control C, go back here. Now I don't have the big block down here, so I'm just going to hit this blue plus button over here. Click on that. Again, opens up the bottom. Control V and save. Just FYI, everything down here in the blue on the bottom is happening on your local computer. Until you hit the plus button, nothing goes up to the server. And there's a reason for that. There's about 6,000 people using the VMSG dashboard. And if you're working on just your local computer, you're not affecting anybody else until you actually hit the save button. And then in a fraction of a millisecond, it sends that data up to the server. So it's a very effective way to do multi-user computing, just kind of an FYI. And then let's go back and grab the third goal here, reduce smoking in public areas. Control C, go back to here. I'm going to hit the plus button again. Control V, and I'll save that. Now, at the goal, objective, and activity, well, even at the service level, you've got the this number over here, which is your sort order. So you see they're sorted in this order. I could turn these around and move this one to the top and move this one to the bottom just by changing the sort order number down here. For now, I'm going to leave them as they are. Okay, so the next thing I want to do is go to the objectives for the goal of reduce smoking in high schools. So there's two choices. I can either click on this and then hit the objectives tab, and it'll give me the objectives just for reduce smoking in high schools. Or if you want to save a mouse click, there's this drill down button over here. So if I click on this top drill down button, it's going to select reduce smoking in high schools and drill me down to the objective level. So I'll do that. So all it does is save you a mouse click. But if you got bunches and bunches of them in there, it's kind of easier to navigate around that way. So now I've got my my block down here on the objective. So I'm going to go ahead and open that up for now. Go back over here and scroll back to the top. And my first objective, reduce smoking at Wayne High School by 25% by the end of the school year. Let's grab that. Again, Control C, go back over here. Control V, paste it in there. We'll go ahead and save that. Now, the next thing we're going to want to do is figure out what are we measuring. So at the objective, we're saying we're trying to get a 25% reduction. To change the measurement down here, it's a little cryptic maybe, but this title where it says objective percent done is the default. So in the objective, 0 to 100% is the default. I'm going to click on this title, and it opens up this little window for me, and I'm going to change this to percent reduction. And if I could spell, it would be better. And my measurement units is this percent sign you see that's on the right side of the field here. So I'm going to go ahead and leave it as percent because it's now percent reduction. I can select decimal or percent. Decimal is widgets, whatever I'm counting. I'd be counting car seats, vaccinations, anything that I'm counting at the objective level, I could use that. In this case, we're still counting percent. So I'm going to select percent down here. And now you'll see we have percent reduction. It says it's currently at 0%. If I wanted to update it from here, I'm just going to say, okay, let's say we're at a 20% reduction now. So it marks it as 20%. Again, anything I do down here, I have to save. So I'm going to go ahead and save it again. Now, when you, pardon me one second here. Anytime you change this value down here and it's not on a field that automatically sets a traffic light, it's going to ask you, do you want to change the traffic light? So we're at 20% out of 25% at this point in time. I might want to say, yeah, the light is yellow. So I'm going to click through here and make it yellow and go ahead and save it here because we're a little behind. Now, at this point in time, I probably want to put a note in there as why I set it for yellow. And so if I click this little button right here, it puts a date, time, and person stamp. Normally it would say Fred Erickson, but I'm the system admin today. I'm going to say, I'm just saying it's only at a 20% reduction so far, comma, set. So the value of having the notes in there is you're not the only one looking at this particular objective. If somebody else looks at it, they can go in and say, oh, I see Fred Erickson put a note in there that says the reason the light's yellow is because we're only at a 20% reduction. Nobody has to call Fred and figure out what's going on. The next thing we're going to want to do at this level is assign the objective lead. So I'm going to go ahead and hit the drop down here. Now, nobody shows up in here because we're in a demo group and nobody's assigned to the demo group. So I'm going to hit show all users. And let's see, I'm going to pick Sarah here as our objective lead, close that down. So Sarah is now the objective lead. And again, I have to save it. And you'll see up here in the top right, Sarah appears up here. So that is the objective. Now, one other thing I wanted to show you is this data source. The data source is where am I going to go if I have a source? Where am I going to go to get the information to update the current status of the Wayne High School smoking reduction? To set that data source, I just click on here, opens up this window. So first I'm going to put a description. I'm going to say it's the CDC Smoking Cessation Fast Facts webpage. So CDC my typing is not so good today. Now, there is such a thing out there, but I don't have the entire link. Typically, when you got a deep link on a web page, you're going to go to that website, then you're going to go up to the link up there, and you're going to copy it and paste it into here. For now, I'm just going to use the CDC website. So you got to start out with an HTTP or HTTPS or FTP, some designator like that, //www.cdc.gov. So now what I've done is given it a description and actually entered the link in there. I'll hit OK. So you see down there it says Smoking Cessation Fast Facts webpage, and I got the link over here. I'm going to go ahead and save that again. And to get to that webpage, the only thing I have to do is click on this little link button here, and it's going to open a new browser tab and take me to the CDC website. So if you have a place on your intranet, on the internet, on your web file servers, any place, you can put that link in here and have that at your fingertips. So I always know that I can go in and do the update on here. So this is my objective. This is the target that we're trying to accomplish. Now, the next thing I'm going to do is enter those activities that will get us to this target. I'm going to go down to my activities tab, open it up here. Let's go back to here. Our first activity, I marked them as a project-based activity. So I'm going to go ahead and click on, I grab that, Control C, go back over here, enter the activity, Control V. So we're going to create the training content. In this case, again, because it's a project-based activity, and here's the drop down to select the type. It's a project-based activity. We have to come up with a performance metric. So I just happen to have that over here, that training content, materials created, Control C, go back over here, Control V. Let's go ahead and put in just October 1 through October 31st as our dates, and go ahead and save that. So now what I've done is created the first activity as a project-based activity. I put in the performance metric. How do we know when we're done? I put in a date range, and we're saying we're doing it this month here. And then I could go in here at this point in time and say, how far along are we? The next thing I'm going to want to do is put in the activity team. So I'm going to click on this little pencil icon. Now, the reason, again, nobody shows up in here is because we're in the tobacco group where nobody's assigned. So I'll hit the little black X to open it up to everybody. So let's go down here and let's say we're going to attach Frank as the lead. So when I click the lead column here, the 3 columns, it automatically makes them a team member. They have to be a team member to be the team lead. And by default, Frank is going to be the person getting the email notification. And then I'll go ahead and select Nikki and Joseph as team members over here. And I'm going to save that. Now you'll see down here, the L indicates lead and the blue around the L indicates email notification. And then you got Nikki and Joseph as team members over here. So that's the team that's going to actually be doing this activity in this given time frame here. The next thing I would do is, and I don't know if you guys don't have any external partners in here yet. The left side of here would be the partner organization. So you might remember in the last training session, we had VMSG dashboard as a partner organization. When I clicked on that, one of the contacts we had was Fred Erickson over here. So I can assign, there's a green checkbox over here. I can assign as many partners and as many contacts from each partner as I want to that. And all this is attaching the partners as a reference. So you'll know who you're working with on this particular activity in there. So as you guys start developing external partners, you put them in there and then they're going to show up so you can select them down here for the partners. So this is our first activity. Let's go back and grab our second activity, which is to provide the 9 training sessions. Control C, go back over to here. I'm going to add an activity, Control V. So we're going to provide 9 training sessions each month. We know this is a quality assurance activity, so I'll select that. And poof, there's the wizard. The wizard, this little button right here opens up as well, but it automatically opens when you enter a new type of activity. Frequency. So as I mentioned, it can go anywhere between weekly and every 5 years. In this case, we know we're measuring monthly, so I'll select that. I'm going to go ahead and select the start date back to October 1st again here. I'll talk about this timeline here in a few minutes. For now, we'll just leave it there. And then here's the values that we set for the traffic light. So we know that if we get to the 9, it's going to be green, and we decided to pick 6 as our number for red. Then you see it calculates the yellow is greater than 6 and less than 9. And then our metric type down here is training sessions provided. And when I save this, it creates the performance metric for me. So training sessions provided, measured monthly, green, yellow, and red. So our beginning date is 10/1. When we get to the end of the cycle, it's going to move it up to November 1st. You notice the light is red, and that's because we're sitting empty as 0, basically. So we're sitting below the 6. If I move this up to 7, for instance, you notice the light automatically turns to yellow. I can go ahead and save that. Okay, there we go. So this is the QA activity. Now, just another option on here. I'll talk about the timeline in a few minutes, but if I wanted to have something that was less than is better, so use the example of a golf score, lower is better. If I click on the little greater than or equal to, it'll flip to a less than or equal to. This one down here will flip to a greater than or equal to. The numbers will zero out. Then you can put in new numbers. So I might say that if it's less than or equal to 3, it's good. If it's greater than or equal to 6, it's not good. So you can flip those around real easily. So we'll go ahead and get rid of that. So that is let me save that just one more time here. Now, after the first time that you save this activity, the next time you save it, it says, do you want to update the cycle start date? So we're saying we're in 10/1. Now, if this is going to be the last training session that I would be doing because I ran out of time in the month or whatever, I could say, yes, I'm going to either say pick today's date, which would be the 15th, or I could say select a date, or I can just say no, leave it as is. If I say select a date, it just gives me a little field to enter a new date. You see the default is 11/1 of 24. I'm going to go ahead and say that, but I can go ahead and edit this to anything I want it to be. I'll go ahead and say okay. And now you see the new start date is 11/1. So my next measurement will be in the month of November. So it kind of automatically moves that ahead for you based on the fact that it's a QA activity. Activity number 3 here is our quantitative measurement activity. Copy that, Control C. I'm going to go ahead and add a new activity down here. Control V, paste it in there. So contact all 20 tobacco vendors. We know that that's a QM activity, so I'll select that. And again, you'll see that the wizard opens up here. Let's go ahead and use the same start and end date here. So I'll use October 1 through October 31. By the way, you can type these in here as well if you want to. It's just easier for me to use the calendar. We know we have a target number of 20, so I'll put that in there. Decimal or dollars. This is the type of activity you use if you're managing grants, you're managing budgets, anything else, you can just calculate dollars. In this case, we're going to say decimal. It's going to be tobacco vendors contacted. So that's our metric type in here. Now, we have a couple of data entry types. I'm going to start out talking about enter a value to add a total. I'm going to save this. So it says our performance metric is 20 tobacco vendors contacted between 10/1/24 and 10/31/24. So that is the performance metric in here. Now, a couple of other options on the wizard here. And oh, by the way, so the add to total here, you notice it has an add to field. So if I put in 5 in there, it rolls up the running total to be 5, calculates it to be 25%. I'll go ahead and save that. And then the add to total again. So maybe that week I put in 5, or I did 5 trainings or 5 contacts. Next week I did 5 more. It rolls it up to 10, calculates to be 50%. So that's what that one's all about. And then again, it's going to ask me, hey, do I want to update the traffic light? No, I'm moving through the week, so I'm going to say no, I'm going to leave it as green. Now, if I click the wizard again here, if I change the type here, enter a new total value. So let's say I'm planning on doing all these contacts within 1 week, and I want to go in at the end of the week and just say, I've contacted all 20 tobacco vendors. It's going to calculate it to be 100%, and I'm all done with that. The other option that's in there is a little bit hidden. It's what we call a zero target. So I'm going to go ahead and put it back to add to total, and I'm going to zero out the target. If you don't have a target quantity and you just want to know how many did I do, how many contacts did I make, how many car seats did we install, how many vaccinations did we do, at the end of the month, you can do that. Now, that target number is your denominator. So if it's 0, you can't divide by 0, so we can't calculate the percent. So it's all it's doing is adding to the running total here. So if I added 5 more, it's going to say we did 25 contacts this particular month in there. So those are the different options. Now, I did want to go back to the first one. There is a couple of options on that one as well. Data entry type. The default is 0 to 100%. So I'm putting in how far along are we over here. We're 50% done. We're halfway done. We're 75% done, whatever. Or I could say, I just want to go in at the end of the week and say, I'm done creating everything. I want to mark it as complete. So when I do that, the field becomes a checkbox. So I click the checkbox. This particular type of activity, when it's 100% complete, turns the light to gold for you automatically. So I'll go ahead and save that. Again, the traffic light is automatically updated, so I don't need to worry about that. So now you see we have the gold bar indicating this one's completed. And there is one other option, and that is yes, no. If you have an activity that's kind of worded as a question and you want to be able to say yes or no, you can use that one. You notice the checkbox over here changes to yes is checked, no is unchecked, no is 0%, yes is 100%. So it's just a different way to enter the data in there. I'll go back to percent complete. Oh, I'm sorry, wrong one. I wanted to go percent complete. 0 to 100%, I'll save that. So we're back to 100%, save that. And no dupe. Okay, so these are the 3 activities that we believe are going to get us to our objective. And if we go back and look at that in the pyramid again, oops, get to the right place. So the group was Tobacco 2024. The initiative was tobacco cessation. The goal we were working on was to reduce smoking in high schools. Our SMART objectives were reduce smoking at Wayne High School by 25% by the end of the school year. And then the activities, create a training curriculum, provide 9 training sessions per month, contact the local tobacco vendors. So that's the operational planning process. Now, I'm going to go back in and show you this one other type of activity. And just FYI, it has absolutely nothing to do with the plan we're working on, but I do want to show you the activity because it's pretty cool. I'm going to add a new activity. So I'm going to hit the plus button, and I'm going to say update SOP, Standard Operating Procedure 1, annually. So what this is all about is managing critical documents. It's a QA activity, so I'm going to select QA. So it's annual is our cycle, so I'm going to set the frequency to annual. I'm going to set our start date to the beginning of the fiscal year. So I'm going to go back to, I'm going to assume that July 1 is the beginning of the fiscal year. And I'm going to select this timeline checkbox. Now, when I do that, all the other fields go away and it's just a percent to yellow. What we're saying here is what part of the way through the year do I want the light to turn yellow so it notifies the lead to update this particular standard operating procedure. I'll go ahead and say 90%, which I think is like 10 and a half months through the year, something like that. My metric type would be update SOP, and when I save it, it's going to say update the SOP, measured annually. When it's less than 90% of the way through the year, it's going to stay green. When we get to 90%, it's going to turn yellow. If we get all the way through the year and it hasn't been updated, it's going to turn to red here. Let me go ahead and save this. Now, what you're going to use this for, again, is some sort of a critical document. So let's go ahead and just pick a team member. Let's go down and pick Cynthia at the bottom here. So I'll save that. So now Cynthia is our team member. I'm going to go ahead and attach a document. This is document management. This little blue folder is on every screen in the system pretty much here. So I'm going to go ahead and attach a document. I'll click add, choose a file. I'm just going to pick a little test file that I have out there. Let's see. Where's my test? There it is. So I'm going to say it's health and wellness. So I'll click on that one, upload it. I'm going to call this SOP1. And I can put in a traffic light. I'm going to say it's green for now. I can put in notes. I can put diamond date stamp notes, whatever I want to do. I'm going to go ahead and save this. So now what we're saying is we have this SOP document attached to the activity. Here's what happens then. So we started out at July 1st. So sometime about mid-May, this light is going to turn yellow. When this light turns yellow, Cynthia is going to get an email notification saying the SOP number 1 is due to be updated. It's going to have a link that takes her right back to this activity. She's going to go to the document. She's going to download the document out of the system. She's going to do the updates to the document. She's going to upload the new document to the system. She's going to come in here and save it. When she does that, because it's a QA activity, it's going to ask if she wants to move the date ahead. So we're going to move the date to 7/1 of 25, and the whole process is done. So basically what people use this for is to manage critical documents. A lot of times you'll see at the group level, you'll have a group called critical documents, and maybe your first initiative would be SOPs. And then you have one for memos of understanding, MOUs, and policies and grant documents. So you're going to break them down. So you're going to start breaking down the plan till you get down to the activities, and then each activity will have a specific document attached. So what this allows you to use it for is what we call intelligent document management. Automatically notifies the people who are responsible for updating the policies and the documents and everything else whenever you need them to be notified. And by the way, if you get past that, get to 100% of the year, so you get back to 7/1 of 25, the light turns red. If it hasn't been updated yet, everybody gets notified that the document has to be updated. So those are the different types of activities I wanted to show you here. Now, as I mentioned, there's homework. And the homework is real simple. Create a simple operational plan. Here's how to do it. I'll walk you through the process. I'm going to go back to my group screen. And what I'd like you to do is log in, go to the training group down here at the bottom, go to services and initiatives. So we have one already that somebody put in here a while back. So you're going to put in a new initiative. So you hit the plus button here, type in tomorrow's my birthday. So we're going to say have a birthday party for Fred. That's going to be my initiative. And then I'm going to go down to the goal, and the goal might be have the best birthday party that Fred ever had as my goal. Underneath that, I'm going to have an objective. We're going to select the venue for Fred's birthday party as my objective, and we're going to select it by the end of today. And then I'm going to have some activities. I'm going to talk to my neighbors about what venues that they used. I'm going to go to Yelp and figure out what are good birthday venues, that sort of thing. So if you can figure out a way to do one service, one goal, one objective, and then potentially if you can figure out a way to use the 3 different types of activities. So the QA activity, QM activity, and the project-based activity. Enter the plan in the system. You'll notice up here that Ebony put this in here and she put EF, her initials. So just do that on when you put your service in there, just put your initials. That way when we review it, we'll know who did what in the system here. So that is your homework. We will schedule a follow-on session. If it's just going to be a few of us, we'll probably combine it with the performance monitoring training. But any questions on entering the your little operational plan?
No, all good. And we're already set for our next session, I think next week.
Oh, that's awesome. Great.
Yes.
Let me give you one more little piece of information here that might help. If you go up to the blue eye up here, help and information, and the very bottom down here, if you download this document, which is implementation guidelines, page 2 gives you a step-by-step process to enter an operational plan. So if you forget or you have any questions about it, go there or pick up the phone and call me or email me or whatever.
Okay.
Okay, so now what I'm going to do is when we're done here, I've got another training to do right after this. But when I'm done with that, I will put this video up on YouTube. And if you guys wouldn't mind forwarding it to everybody else who should have been on or was going to be on here today. And then also, I'd like to ask them to do the homework as well. They should be able to, based on listening to the video, they should be able to do the homework as well.
Okay. Thank you.
Does that work for everybody?
Yes.
Okay. Thank you so much for your time. I look forward to seeing you guys next week. Nikki, yes?
Thanks, Fred.
Well, you're certainly welcome. You guys have a great day.
And have a happy birthday tomorrow.
Oh, thank you so much. I'm older than dirt, so
Take care.
bye-bye.